Go for a walk. It's a beautiful day. Thank you for tuning in again today at 1 o'clock. I've become accustomed to doing this, and I know many of you have as well. It's a time for us to be together and for me to share with you some information about where we are in our continuing fight against the coronavirus here in the state of Rhode Island. I want you to know that I feel that we are absolutely headed in the right direction. I can't say I feel good about things because there's not a lot to feel good about, but when I think about what we've done together in the past month to deal with this crisis and ready our system and now beginning to ready ourselves to get back to work, I feel proud of so many people. I feel that we've done about as good of a job as we could have keeping everybody safe, and I feel so grateful to each and every one of you who is sacrificing and leaning in and being generous to help us all get through this in the safest, best, quickest way possible. So as we end another week, or it's a Friday here, I just want to say thank you and let you know that I feel strong and confident and hopeful about what lies ahead. Having said that, you will see the numbers on the screen, or will be on the screen shortly. We're still in the upswing here in Rhode Island. Our cases are still continuing to go up, deaths still going up, hospitalizations still going up. I hope that soon we can start to, turn the corner and get ourselves on the downswing. I know that all of your hard work has helped us to flatten the curve, so it's not going to be as bad as it would have been. And if we just hang in there for these next couple of weeks until May 8th, it is my hope that by that time we will be on the other side of the curve and on the downswing. So hang in there, and again, don't be alarmed by the numbers that you see on the screen. We're still climbing, but not in a way that is surprising. Having said that, it's no less difficult for those who have lost a loved one or who are sick themselves, so our thoughts and prayers and hearts go out to all of you. I want to start, before going through some of the official announcements, I just want to start for a second with a message of hope. And the fact of the matter is, as the days are dragging on, one of my staff members said yesterday that we should wear different clothes to let ourselves know which day of the week it was, because every day feels about the same and every day feels like a Monday. And, that's tough, right? Like, every day bleeds into the next. We don't know when it's going to end. We don't know when we're going to go back to school or back to work. I do not want to minimize that. The physical challenges, the financial challenges, the mental health challenges, it's real. It's real. It's getting tougher. And by the way, it's for everyone, in my family and yours. But here's what I do know. It's not going to last forever. It's absolutely not going to last forever. There is another side of this, and we're going to soon get to the business of getting back to normal. Now, it's not going to be the way it was probably for at least a year until we have a vaccine and until we have some really excellent therapies. But it's going to start to feel a little more like normal. And that's something we can all look forward to. And in the meantime, the thing that gives me hope is the everyday expressions of kindness, creativity, resiliency, and bravery and strength that I see. And I mean every day. And usually when we think of someone being brave, we might think of a first responder or somebody in the military. And by the way, they are brave. We have nearly 1,000 members of the National Guard being brave every day at our swabbing centers or setting up hospitals, and I want to thank you for that. Our healthcare workers are the bravest among us right now. God bless you, truly, and thank you for your bravery and your strength and your courage and your stamina. It's harder than ever, and we're right there with you. But also I think about, the couple who's trying to co-parent their kids, and it's hard. Maybe the children are with mom. So, and Dad is going to work and delivering groceries and occasionally seeing the kids. That's really hard. It's hard. It's hard for Mom who's cooped up in the house, and it's hard for Dad who doesn't get to see his kids regularly. So you're brave and you're courageous and you're strong. Or I think about someone who's going way out of their way in order to help their neighbor, even though they might not have enough themselves. But they're finding a way in their heart and in their wallet to share a little bit. And on and on and on. Every day it's happening. It's courageous and it gives me hope. And the fact of the matter is, we're going to get through this. And I think we're going to get through it. It won't be without a great deal of suffering and loss and hardship. But we will be stronger and more resilient on the other side. And so I find a great deal of hope and strength in the selflessness and courage and hopefulness that I see every day, and I see it even online, some of the ways folks are trying to help each other. So hang in there a bit longer and know that at least on my team, we are doing everything we know how to do and working as hard as is humanly possible every minute of every day to get through this as fast and as safe as possible, and to support you financially and every other way every day between now and when we get to the other side. To that point, I have had to the point of providing support to people in order to get through this. We've gotten some questions recently about supports for workers who have contracted the coronavirus, potentially at work or in the line of duty. And as I said before, this is an especially difficult time for everyone, but most especially for our healthcare workers, doctors, nurses, therapists, CNAs, custodians in hospitals and nursing homes, etc. And so today I have, by the way, said all along, there's been so many companies in Rhode Island who've been fantastic. I won't list them all, but either giving charity or keeping people employed or whatever they can do. Today I want to recognize one such company, which is Beacon Mutual Insurance Company. Beacon Mutual Insurance Company is the predominant provider of workers' compensation insurance in Rhode Island. They insure over 12,000 Rhode Island businesses. And I'm announcing on their behalf today, we've been working with them, that Beacon will be allowing frontline healthcare workers to file for workers' compensation under the presumption that they contracted the virus in the course of doing their jobs, and Beacon will expedite those claims. That includes doctors, nurses, EMTs, home healthcare aides, and others. So I want to thank Beacon for stepping up and doing the right thing, because it's the right thing to do. And if you fall into that category, if you work in a healthcare institution or EMT or a home healthcare worker, and you've unfortunately contracted the disease, you'll be presumptively assumed to have gotten it in the line of work and therefore eligible for workers' comp from Beacon Mutual. Now, I do want to remind you that this is an additional benefit on top of the coronavirus TDI, which we have made available, the unemployment insurance benefits, the pandemic unemployment assistance, and the TCI that we're providing. So there's a number of different benefits available if you have either lost your job on account of coronavirus or if you've contracted the disease on account of your job. A few other points. Yesterday I provided a model showing what the disease might look like here in Rhode Island in the weeks to come. And as I said then, it obviously, depends on how successful our new regulations are and how much each and every one of us obeys the stay-at-home order for the next couple of weeks. But our goal the whole time has been prepare for the worst, work for the best. And so along the lines of preparing for the worst, I've had a team spending the past 5 weeks preparing our state for additional surge capacity in our healthcare system if our hospitals become overwhelmed, as we unfortunately have seen certainly in Italy and New York City, Louisiana, Washington State. Unfortunately, in those places they peaked sooner, and it was pretty much impossible to get ready for the surge in the hospitals. I'd like you to know that your hospitals here have been fantastic. They are ready, and they have worked collaboratively over the past month with my team to make sure that we can handle a surge if and when it comes. Specifically, I want to thank our hospital leadership who have put forth their own plans, which we've approved, to increase their collective capacity by almost 250%. The team, my team, working with hospitals, has been led by an unbelievable woman named Daisha Reed, and her team has more than 50 people. It includes personnel from the National Guard, Emergency Management Agency, Department of Health, and the Department of Labor and Training. It also includes hundreds of construction workers, architects, electricians, security guards, housekeepers, medical suppliers, and on and on. You can imagine everything that it takes to establish and run a new hospital. And, you know, I feel it's important that you know, first of all, that it's going to be safe. It'll be safe. We are ready. We're working our tail off every day, and so are you, by staying home, so that we never get into a situation, and I don't think we will get into a situation where we need 3,000 hospital beds. But if, God forbid, we do, we're on it, due to the hard work of so many people who've shattered records to make sure hospitals are ready for a surge and we have backup hospital beds. They've done this, when I say shattered records, in record time. To put this in perspective for everybody, it was only about 4 weeks ago that the Army Corps of Engineers landed here in Rhode Island to start looking at potential places where we might have field hospitals. Just a few weeks ago that I was fielding questions. Can we get the Army Corps to come here? Are there extra facilities? Will we be able to, you know, have extra hospital beds if we need them? And I said to you then with confidence, yes, we have a plan, we have a team, and we're on it. And I want you to know that in these 4 weeks, due to a lot of hard work, we, in a couple of weeks, will have the capacity in 2 field hospitals, one at the Convention Center and one at the former Citizens Bank complex in Cranston, for over 1,200 new beds. And I cannot thank the leadership at Lifespan and Care New England enough. They have been collaborative team players working with each other and with us to make this happen, and to make sure that if and when we need to open these hospitals, they will be staffed. I also want you to know, we use the word field hospital. I've heard sometimes in the media, makeshift hospital. That's, I think, maybe a misnomer. You know, these are really excellent facilities, places you will be able to be cared for and get better should you become sick. So thank you to everyone who's been part of that great work. On the theme of working for the best but preparing for the worst, we also need to be ready if we get to a place where there's a shortage of medical equipment or supplies or medicine in the event that we are overwhelmed. I want to be clear, I don't think we'll get there, but we need to be prepared just in case we do. So later today, the Department of Health is issuing guidance, and we're asking all of the hospitals to adopt this guidance in their planning around ethical guidelines and guidelines for crisis standards of care. All design, a great deal of thought has gone into these guidelines. Dr. Alexander Scott, her team, ethicists at Brown Medical School, in partnership with Lifespan Care New England. It's his excellent work just to make sure we are ready if we get into a place where we have to make difficult decisions around provision of health supplies and hospital beds. Finally, I want to give a huge shout out and a thank you. I have been up here day after day asking you if you are a healthcare worker who's working part-time or retired. I've been asking you to go to riresponds.org. You know, it's one thing to build hospital beds and for hospitals to have surge capacity, but we also have to staff them. So you should be very pleased to know that since I've started asking for folks, more than 3,300 healthcare professionals, physicians, nurses, CNAs, and the like, have already gone on to riresponds.org to join our state's response. It's incredible. I'm grateful. Again, it gives me hope and confidence, especially as I now spend my days thinking about how to get people back to work, how to get kids back to school, and to do it safely. I need to know that if we start to have more cases, we'll have the staff that we need to keep everyone safe. So if you have if you are a healthcare worker who wants to serve and you haven't yet signed up, riresponds.org. If you're one of the 3,300 who has, thank you. Thank you. I wanted to say another thing about personal protective equipment, all on the same theme. You know, we have to make sure we are ready for whatever comes our way. About a month ago, or I guess a month and a half ago, I reached out to Steve King. Steve runs Quonset Development Corp. He's largely responsible for the terrific innovation and growth of Quonset. I called him. He's an expert in logistics, former military, and has been a valued member of my team from day one. I called him late one night and said, Steve, I need you to run our supply chain on PPE. That was a Saturday night. Sunday morning, he was in the office, and he hasn't stopped working since. He manages a team of probably 20 people, many volunteers, trying to make sure his goal, is to make sure we have a 30-day supply of PPE on hand at all times. We're not there yet, by the way. That's, I'm sure, going to be the first question. I'm hoping in a week-ish we'll be there. We're still struggling to get everything we need, but that's the goal. And that means even when we hit the peak and start to come down and maybe go up again at some future time, we'll always have 30 days of PPE in our own kind of Rhode Island stockpile. That is gloves, masks, gowns, surgical masks, ventilators, and on and on. So I want to thank Steve and his team for their work. We're not out of the woods yet. It's still a struggle. We're still competing with other states and with the federal government, but it's starting to come in, and I wanted you to know the gold standard, we think, is 30 days on hand at all times. To give you a feel for the magnitude of what we're talking about, in just the last week, we've received just over 1.2 million surgical masks, 1.5 million gloves, and 10,000 face shields. We've placed additional orders for more than 10 million surgical masks and another 1 million N95 masks, tens of millions of gloves, and hundreds of thousands of gowns and face shields. I want to take a second to thank the 240 businesses in Rhode Island that have each stepped up to donate supplies, and I want to acknowledge Apple and the New England Patriots, each of whom donated to us about 100,000 K95 masks, and I want to acknowledge Louis Yip of the Rhode Island Association of Chinese Americans, who's donated 200,000 surgical masks. So if you're out there and you're a healthcare worker and you're frustrated that you're having a hard time getting access to PPE, help is on the way. because we're finally starting to see the supply chain open up, and that magnitude of what we're ordering should give you some sense that it's going to get a little bit better every day, and know that that's what we're working towards. In the meantime, I wish you didn't have to reuse your masks, and I wish it weren't so difficult. And again, I'll say you're truly the heroes of this fight, and I'd ask everyone to continue to be brave. Continue to be brave. I will say, good news, we're just a couple of days away from deploying the Battelle system in Rhode Island, which allows us to sanitize thousands of masks at a time so that they can be safely reused, the N95 respirators. And that, once we get that up and running over the next few days, that again will be a huge relief to the system. The question that is top of mind for me, of course, is when can I get everybody back to work? And I'm trying to figure out when that is. I'm going to have a lot to say about that next week. But the reason I'm focusing now on hospital beds and PPE is because those were all the necessary conditions that I had to have in place before we can think about safely reopening our economy. So with that, I'm going to turn it over to Dr. Nicole and then come back to answer questions.
Thank you, Governor. Good afternoon. As was posted on the data dashboard on the Rhode Island Department of Health's website, we unfortunately have a number of additional fatalities to report. Our number of fatalities was previously 105. With the 13 additional fatalities we are confirming today, we now have 118 total fatalities. We express our condolences to all of the families who are directly impacted. Of the people who have passed away, one person was in their 50s, 2 people were in their 60s, 7 were in their 70s, 1 person was in their 80s, 1 person was in their 90s, and 1 was more than 100 years old. 10 of these people lived in congregate care settings. 9 of these fatalities occurred yesterday. The other 4 fatalities occurred in the days leading up to yesterday. Like states across the country, Rhode Island is facing extremely difficult challenges in our nursing homes. Every day, you hear the evidence of this as the number of positive cases continues to grow, as well as the number of unfortunate deaths. I said that we would take some time today to share with you the most aggressive, comprehensive approaches that we're taking together with the nursing home community to do the best we can to support the residents and staff and administrators. I want to assure residents of our nursing homes and other congregate settings across Rhode Island, as well as their families, that the state is doing everything we can to keep residents in these and other congregate settings safe. We are doing this by working cooperatively with our nursing home administrators, as well as the dedicated staff, not only to ensure the safety and care of residents, but also to support the professionals who have dedicated their careers to caring for this vulnerable population. I want to start with evidence of the measures that we have been taking up until now. And then I'll go into what we're doing from now going forward, so you have a sense of the picture, a snapshot of the types of measures being taken. From the start of the crisis, we have focused our efforts on several key strategies, beginning with preventing the spread by prohibiting visitors to nursing homes, as well as isolating individuals at the first sign of symptoms and quarantining their close contacts. Due to our connection with what other states were learning and also assessing the research, we had an understanding early on that symptoms can be very atypical in this community. You can sometimes have situations in our seniors where symptoms may not be present, or they may be very mild or different from what you would usually expect. We've worked closely with nursing homes to have a very low threshold for concern based on symptoms or any changes connected to a resident so that we can be aggressive in determining when there was a potential for COVID-19 that needed to be assessed, when the residents needed to be isolated, and the appropriate quarantining of the contacts as well as the staff. We've also taken aggressive steps in terms of testing, which has been critical to meeting the nursing home's challenges. We've gone beyond what the usual approach is with testing because of the congregate care setting. We've addressed testing for the employees of the congregate care facilities, knowing that that is just as critical to help us understand how to best care for the residents. That way we have been able to cohort staff who may have been exposed to COVID-19 but are now symptom-free and could work. Those were best to continue to care for residents who are COVID-19, who have COVID-19 in the nursing homes versus staff who have not been exposed. I've also shared the approach of really limiting how many staff persons enter a resident's room. We've also had discussions across all the nursing homes of really understanding where staff members are working in terms of their facilities. So if there is one facility that there's been concern of a case or a person who has been identified as having COVID-19, in assessment of all of the staff in that facility, we've also looked to determine which other facilities does the staff person work at so that we can look aggressively at how to implement infection control practices at those additional facilities as well. Along those lines with testing, we now have established a fast lane for testing of healthcare workers from nursing homes through the CVS test site at Twin River. Currently, there are 200 dedicated spots per day specifically for the healthcare workers and staff who are working in congregate care settings so that we can continue to assess what the exposure is and be able to assign the appropriate staff to the appropriate residents when possible. We realized early on that we needed to supplement our workforce and eliminate any barriers to doing so as quickly as possible. To date, we have licensed an additional 960 healthcare workers to be able to provide support in these congregate settings. Mechanisms that we have taken to accelerate this process include fast-tracking licensing for out-of-state professionals who are here in Rhode Island and can now join the workforce quickly and effectively. We've waived the training requirements for certified nurse assistants whose licenses may have lapsed within the last 2 years so that they could also accelerate their ability to join the workforce. We've moved nursing students into the workforce quicker by issuing temporary nursing assistant licenses for those who have completed at least 1 semester of nursing school and could begin engaging in the work settings with the appropriate supports. We've accelerated training programs for those individuals who want to be certified nurse assistants so that they can gain the training they need in a fraction of the time usually required and then begin to join the workforce with the appropriate supports as well. And we've also created robust outreach efforts to newly licensed healthcare workers to be able to help support what's needed in the nursing home settings. Now I want to spend a few minutes about where we are now and what we are looking to do going forward. Moving forward, we're looking to develop strike teams to enhance what we have already implemented and to further support the nursing homes currently. These strike teams will coordinate the efforts I have mentioned and be able to expedite a process where we can strategically provide what's needed for nursing homes that are experiencing a variety of challenges. This will include providing on-site testing at nursing homes where there are outbreaks so that there can be a rapid turnaround in the results and changes made as needed. That testing would be available both for residents as well as for staff. We would also be able to ensure a continued focus on infection control measures taken as aggressively as possible, assure appropriate personal protective equipment that's needed for nursing homes, particularly those with clusters of cases, and assess the quarantine and isolation protocols in the priority congregate care settings that need to implement them most effectively. From a testing strategy perspective, we are also implementing a cyclical testing program for all nursing homes so that staff and residents, where appropriate, can be tested continually every 7 to 10 days. The reason this is important is because we have a specified area as a congregate setting where we can work closely with that entity to understand the best interpretation of those test results. We always talk about the fact that testing is reserved for people who have symptoms for us to get the most accurate results. In this congregate care setting, it's the unique time where we can use testing strategically in cooperation with the nursing home to better understand that point in time. It's really helpful for when there is a positive result. It's less helpful for when there is a negative, because particularly if we are completing the test on someone who does not have symptoms, it is not as reliable to just disregard any concern for COVID-19 if a negative test occurs. But it's extremely helpful when we can have a positive result and be able to respond to that in terms of the cohorting and the other aggressive infection control measures that we're taking. Knowing that this testing result gives us that one point in time, we're looking to be aggressive into having a cyclical approach so that we can repeat the tests on a regular basis and continue to assess across the nursing home community what the risk is and make updates to the changes that need to be made. This will involve delivering swabs to nursing homes and picking up samples the next day, as well as having a mobile testing unit available for places where there are clusters of cases where we can deploy them to the appropriate hotspots as needed. In addition to COVID-positive nursing homes that I discussed yesterday, quarantine sites can provide a cohorting alternative to containing virus spread. And they're critical to our hospital system's ability to decompress so that we can serve more patients through the surge. So we're also looking to have facilities where we can accept patients as they're being discharged from the hospital so that they're no longer in the acute care setting, but can be monitored in a safe and appropriate quarantined setting before returning to a nursing home so that we can minimize the number of patients who may have COVID-19 back to a nursing home. We're also working to augment the workforce where shortages exist today and to create a sustainable pipeline of workers. To do this, we're looking at an array of options that include developing a facility staffing portal to manage critical resources across the congregate care setting environment. We also know we need to focus on what else we can be doing in the community to support those leaving hospitals, including providing supports to families who are caring for their loved ones who are seniors at home as well. So it's important for us, as we are taking into account this comprehensive approach, to make sure that we are aligning it with the needs of the community, the living conditions that are there, and engaging with the family members who are handling this so that we can provide the support needed. I really want to thank our nursing homes and the dedicated professionals who care for our fellow Rhode Islanders. In addition to what I've discussed, you can know that there is an entire state of people who are behind you to help support us during this challenging time. Finally, I want to echo the governor's appreciation to hospitals and hospital leadership. We have already sent out the guidance that the governor referenced for how we would prepare if we needed to for limited supplies. We often refer to that as having a crisis standards of care. Hospitals have put tremendous amount of work into that. We've provided guidance so that we can have a statewide, consistent approach to how we would need to engage, if we needed to implement safe and equitable approaches to providing care to those who are in need if resources were to be limited. I want to credit the hospitals, as I've mentioned. I want to say thank you to the Hospital Association of Rhode Island in supporting us in developing this, as well as the ethicists and clinicians through Brown that has helped us in pulling this together so that all Rhode Islanders can know there is a thoughtful approach that is in place and will be ready, meeting standards across the state consistently in how we would be able to care for people in need if limited resources were to occur. I'll finish with thanking the governor because of her thoughtfulness and leadership and the teams that are in place. We're hopeful that it is less likely we will ever need to activate those types of crisis standards of care. But if we were to, you can know that we will be ready as a state. With that, I'm going to pass it back to the governor for questions. Thank you.
Hi, Governor.
Hello.
How are you?
Great. Good afternoon.
And to everyone at home, we begin today with a question from Anita Buffoni of WPRI. Governor, some local income homeless people are not able to afford even the discounted rates hotels are offering through RI Havens. Are you considering ways to make these rooms or housing free to those who don't have the financial means to pay for housing and need to self-quarantine?
Yes, we are. Thank you. So first of all, I want to remind everyone we do have the hotel in Warwick, the Wyndham Hotel, which is there's about 200 rooms there, and that's where we are isolating and quarantining homeless folks now. So there is that facility. I think we have about 50 people there, and there's room available. Secondly, we are also working with colleges and universities to see if we might be able to use some of their dormitories for that, but also really for healthcare workers. So if you're a healthcare worker and you don't want to go home because you don't want to expose everybody in your home to the virus or potentially, yet you can't afford a hotel, we are working hard to maybe be able to put you up in some dormitories for free so that you can keep you and your family safe.
Brian Crandall asked a question referring to the model that you released yesterday.
Yes.
The Blue Line Best Scenario model revealed yesterday appears to predict Rhode Island should have about 1,000 hospitalizations right now. Since the reality right now is about 250 hospitalizations, are the predictions significantly overblown or already outdated?
Yeah, great question. So remember, that is hospitalizations. I think until now we've had not about 450, not quite 500, because there's been folks that have been released. And no, it's not, it's neither. The data yesterday was a model, not the actual data. We give you the actual data every day, and then what we showed you were simulations. So the hope, as I was very clear about this yesterday, it's on us. If we continue to obey the stay-at-home order, it is absolutely my hope that our actual experience, not my hope, my expectation, is that our actual experience will be better than the blue line. And only time will tell. Remember, we have very limited data because you don't know the benefit of the social distancing for about maybe 10 days after it's been in effect. So we really only have 3 or 4 days of hospitalization data, which is why I was reluctant to put it out in the first place. So long story short, the red line is a scenario that I think is not going to happen. The blue line is one I think we can beat. Let's beat the blue line by continuing with our social distancing. So on or about May 8th, we can start, beginning our return to normalcy.
The next question is from Michael Bilo of Motif magazine. Germany announced their R-naught has been brought to 0.7 from over 3 in the last 6 weeks, meaning the virus is no longer increasing its spread rate. Do we know the R-naught in Rhode Island? How long will it take for Rhode Island to deploy enough testing, both swab and serologic, to break down the 1.0 barrier?
Okay, so R-naught. It's basically a measure of how infectious the disease is. It's a measure of how many other people somebody who's infected will infect. For a period of time, when we were doubling our hospitalizations every 4 days, we were at an R-naught of above 3. That's not where you want to be. That's an unsafe level. If you're doubling your hospitalizations every 3 days, every 4 days, every 4.5 days, your R-naught is somewhere between 3 and 4. Our best guess right now, and it is a guess, is it's 2-ish, maybe 1.8, maybe 2. We are trying, but a week ago, we were 3+. So what's the point of this? For the average person listening at home, keep doing what you're doing. It is working. Keep doing what you're doing. It is working. Ever since we put the stay-at-home order in place, we've seen improvements, and it has given us time to buy the 1 million masks, get the hospital beds up and running, and do everything we need to do. I will tell you this, and this I know. I don't know precisely what our R-naught is. I don't know precisely where we are on that curve. I don't know if our peak will be April 30th or May 5th. I do know this. If this weekend everybody says, hey, things look pretty good, I'm going to go hang out with my friends. Hey, it looks pretty good, I'm going to have a dinner party. I think I'm going to start going back to work on Monday. We're going to start racing right back up that curve. And all the hard work and economic suffering that people have endured for the past month will be out the window. So don't do it. We got a couple weeks left. You're doing a terrific job, literally saving lives. The difference between the blue line and the red line was more than 2,000 lives and countless amount of human suffering. So hang in there, and let's really nail this social distancing a little bit longer.
For the folks that joined us from the very beginning, you might have heard car horns in the background, and that's what Steve Ahlquist is referring to when he asks this question. From Never Again Action, 52 people were released from the ACI. Over 100 people were honking outside the State House, calling on you, Governor, to use your executive power to free prisoners and ensure safe conditions on the inside. Can you do more?
So thank you for the question, Steve. And yes, I did hear the horn circling the State House, and I appreciate their right to protest. So I am not, however, going to use my executive authority to free all the people at the ACI. What I have done is released a certain number of them who were about 90 days away from release anyway. And what we have done, and that's enabled us to do better social distancing inside the ACI. What we have done is we're in daily contact with the medical staff there to make sure we're ramping up testing, make sure we're doing our best to provide PPE, doing our very best to clean the facility, and we will continue to do that. And as testing gets better and as treatment get better, we'll make sure that the most vulnerable everywhere, including in the ACI, will be the beneficiaries of that.
Our next question is from Tony Mendez, and it's for the doctor, Dr. Alexander Scott. What may explain the reason why almost half of all positive COVID-19 cases are Latinos?
That's an important question, Tony, and we're still understanding the data. We appreciate the advocates who have reached out to continue to get more, because that's what we need to do. We need to continue to dig deeper into answering these questions. We know that COVID-19 does not have a predilection or a favoritism of people who are of Latino descent. We need to understand what's already going on in our communities that would cause certain populations to have these increased numbers. It goes back to messages that people have often heard me talk about, that someone's zip code should not determine how healthy they are or how healthy the community is that they live in. And right now, it does. There's work for us to do here in Rhode Island and across the country. And what we're seeing here in Rhode Island and across the country is the outcomes of that through COVID-19. When we have differences in quality of education, in quality of housing supports, in quality of access to fresh fruits and vegetables, safe streets to walk on, access to family supports, economic development, job opportunities, when that differs and you insert a pandemic like COVID-19, you unfortunately see the exposed result of that, where certain communities, not because they have any genetic predisposition towards getting this virus, but certain communities are more at risk, and unfortunately more at risk of negative outcomes. So it really gives us the opportunity to look beyond COVID-19, see how we can continue to build the community infrastructure that we need to, so that we don't have as many differences based on zip codes, and we support resources and investments into our communities equitably across the board. That's the mention of health equity zones and many of the community-based organizations that work hard every day to advocate for Latinos and many of our important communities throughout Rhode Island.
Perhaps you both could field this question from Bruce Newberry of WADK Radio. It will have taken 6 weeks or more to peak. After the peak, whenever it is, how long might it take for rates of hospitalization, deaths, and positives to go down to the level where the state could reopen?
It's an important question, and one that we are all assessing, looking at data here in the States, learning from what we can from other countries. Before I turn it over to the governor to be able to share more, I want to just relay the message about this virus overall. We know that the social distancing measures that are in place now, they work. We also know that our expanded testing approach with aggressive and comprehensive case identification and contact tracing, so that we can identify the people who have symptoms or who test positive, support them as they isolate safely, and engage with the people who had direct contact with them and help them to quarantine safely and appropriately as well. That's another approach at making sure there's the social distancing, because that's the way the virus stops spreading. The minute you let up on those types of measures, the minute the virus can spread more and lead to new infections. So we have to come up with the governor's leadership and the thoughtfulness of our team and everyone across the state, ways to minimize re-emergence of the virus by bringing people together. And there are going to be creative ways to do that, but it's important to understand that that's going to be an approach needed until we're able to have a vaccine and stop the virus from being present overall In the meanwhile, we do have some vaccines, like the flu vaccine, that is available for people to stop other types of viruses that are present.
Nicole did a beautiful job. I would just say yesterday, the CDC, in collaboration with the White House, put out guidance that in order for a state to think about reopening the economy, they ought to have 14 straight days in a row of declining cases. So that is a guide that I will be following as one measure, as a safe indicator of when we're on the backside of that curve. Next week, I will have a lot more to say about when we'll be reopening, under what set of conditions, what industries might come back first, et cetera.
The next question is from John DePietro. He asks, Governor, advice to people contacting the Department of Labor and Training for unemployment. People keep calling, reach the menu, and reach a message saying no one available to answer the phone call, so they need to call back. Could a system be implemented that people can make an appointment, like at the registry?
Yeah. So a couple things. Everyone, if you can, please just go straight to the website rather than calling, and file on the website for your unemployment or any other kind of benefit, if you're a hairdresser or a gig economy worker, the PUA. Secondly, we are trying to implement a new technological solution that will fix exactly the problem that you say, and I am hopeful that we're going to be able to get there soon. We're just not there yet. I mean, the truth of the matter is, it's an ancient technology system. It was not built for 140,000 claims, and we are struggling through it every day. I will say, as a credit to the team at the Department of Labor and Training, there are many other states, including Massachusetts, that haven't even started processing the PUA claims. We were the first, or one of the first states in America to start getting those checks out. So relative to other states, we're doing an excellent job. Having said that, if you're waiting for a check, you want to know when's it coming. And the only thing I can say is we have a tech team on it, and I hope next week it'll be a little bit better than it has been right now. But we're on it, we're processing everything. And use the website. If you can't get through, try back again later, try back the next day.
Next question is from Brendan McCare of the Pawtucket Times. Have you had conversations with the Rhode Island Interscholastic League, and what guidance have you provided the league as it relates to spring high school sports?
Yeah. I know that we have. I know that the commissioner, Infante Green, has been in touch with them, and you're looking for some guidance. So we will get back to you on that. The only thing I will say is it's going to be hard to engage in any activities that involve crowds for the foreseeable future, but we owe you better guidance than that, and we will get something out to you.
Our last question today for this Friday briefing is from Tanya Signori of the Rhode Island Echo. Good afternoon, Governor. Some large grocery stores and retailers still seem to be full with shoppers. This seems to depend on the time of the day. How can we ensure stores are following maximum number protocols, or can we try and lessen this number?
Yeah. Thank you, Tanya. We've had our eye out too. By and large, statewide, it's not a significant problem. It doesn't mean that what you are saying isn't true. I'm sure it is. In fact, I'd love it if you called my office and told me where you're seeing these crowds so that we can get on it and disperse them. And we'll continue to improve our enforcement. The many retailers are doing exactly what we've asked, checking people in. A lot of them have done the one-way aisles. I would strongly encourage any grocers or retailers who haven't done the one-way aisle to please do that. It alleviates crowding in the aisle. But in any event, I'll continue our vigilance. And I would just say to the people of Rhode Island, as we begin our weekend, just if you're in a crowd, you're doing something wrong. If you're in a deli line and it's crowded, go back later. If you show up and the parking lot is full at a retail shop or a grocery store, try to go back later. It could be the difference between life and death for somebody, and I'd appreciate it if, as I keep saying, May 8th is the day the stay-at-home order is in effect until, and I'm going to hold us all to it, because I think it's essential, back to Brian Crandall's question, let's do better so that everybody can be safe and get back to work as soon as possible. So thank you. Have a good weekend.